So let's start up without wasting time. And the first concept which you need to know is regarding the, right from the second year up to the final year, everybody is confused at what is gram-positive cocci, what is gram-positive bacilli, what is gram-negative bacilli, what is gram-negative cocci. So for that, you need to remember a particular mnemonic that all cocci, they are mostly gram-positive. Okay. If you are seeing it for the first time, that you must be remembering up that the gram-positive cocci names, when you start up in the bacteriology or in the general microbiology, we need to hear up two words like staph and strepto, staphylococcus and streptococcus. Okay. But for your information, I like to tell you that there are 80 others which are gram-positive cocci, but you need not to remember everybody. So remember in this particular sense that all cocci, they are gram-positive except, okay, except the 4 which are gram-negative cocci. And what is the name of those 4? The name of those 4 is, one is meningococci, okay, one is gonococci, one is vinolella, obviously which is less known, and one is Morphological. These 4 are there which are gram-negative cocci, and rest of all others are what? Rest of all others are gram-positive. Okay. And this fact I will tell you that what is this gram-positive, gram-negative stuff. So that I will tell you. Firstly, you get into your mind that most of the cocci, they are gram-positive except the gram-negative cocci. Which one? These particular ones: meningococci, gonococci, vinolella, and Morphological. Okay. And this particular thing will avoid a lot of confusions of yours for a very long time. Okay. Now, after this particular one, this is also a challenge, that how to remember the bacilli. So guys, remember in this sense, all bacilli, they are mostly gram-negative. Okay. They are mostly gram-negative except your favorite burger station, that is known as McD. Okay. So these McDonald's fellows, these are gram-positive bacilli. What they are? They are gram-positive bacilli. The first one is Mycobacterium, and the Mycobacterium is having lot of species. So you write up species as SPS. So Mycobacterium species, and this particular Mycobacterium includes up like TB, atypical Mycobacteria, Mycobacterium bovis. Now you will say, so we have learned in our practicals that they are acid fast. Very right, guys, they are acid fast, no doubt in that. But if you get after them that I will stain it by grams only, then they take up this particular gram-positive ones. Okay. Then A is anthracis. Okay. And which anthracis? Bacillus anthracis. Okay. So A is what? Anthracis bacillus. C is Clostridium. Okay, C is what? C is Clostridium. And as you know, that various species of Clostridium are what? Clostridium tetani, Clostridium botulinum, okay, Clostridium difficile, Clostridium perfringens. This time in the exam, they have asked regarding Clostridium perfringens. So all these are very important. D is diphtheria. D is what? Diphtheria. And the full name is Corynebacterium diphtheria or Corynebacterium diphtheria. So this is Corynebacterium, or they say both ways, Corynebacterium, Corynebacterium diphtheria. Fine. O is just for the mnemonic. N is Nocardia. Okay. A is Actinomyces, and some writes up Actinomycetes. Okay. L is Listeria. Okay, an important species of it is what? Listeria monocytogenes. Okay, and the D is diphtheroids. D is what? D is diphtheroids. So these are the organisms which are gram-positive bacilli. Now, first of all, I like to tell you what is the difference between cocci and bacilli. Cocci are like pointed ones, like a comma. Okay, so that particular one is just like a dot, like this. That is a cocci. And bacilli is like this, like a rod. Fine. So this basic difference also you should know, that the cocci, they are pinpoint like a full stop, and these particular ones, the bacilli, they look like this. That is the rod shape. Okay, so let's revise up once that all bacilli, they are mostly gram negative except these particular McDonald's. M is Mycobacterium species. Primarily it is an acid fast one. A is Anthracis bacillus. C is Clostridium. D is diphtheria. O is nothing. N is Nocardia. A is Actinomyces or Mycetes. They are both the same. L is Listeria. And D is diphtheroids. Okay, D is diphtheroids. And somebody asked you that what's the difference between diphtheroids and diphtheria? So diphtheroids are normal commensal, guys. They are found in your and mine throats. So they are the normal commensal of throat. That is termed as diphtheroids. And diphtheria is a pathogenic one, and it causes what? Diphtheria in the pediatric age group. Okay. So after knowing these two mnemonics, your life will become simple regarding the gram-positive cocci, gram-negative cocci, gram-positive bacilli, and gram-negative bacilli. Okay, so we have talked about this gram-negative stuff a lot, or gram-positive stuff a lot. So first of all, you should have an idea that what is gram staining. Okay, you should have an idea that what is gram staining. Gram staining. This particular procedure was discovered by a famous scientist, Christian Gram, and the procedure is a frequently asked question in the various examinations, and one of the mnemonics to remember it, to make your life easy, is methyl gas. Okay, so this particular sequence they ask, that in which sequence you stain up for the gram stain. So that sequence is what? Methyl gas. And in this particular methyl gas, you need to know what is this methyl. This methyl is methyl violet. Okay. This G is grams iodine. Okay. This A is acetone, and this S is safranin. Okay. So this methyl is methyl violet, G is grams iodine, A is acetone, S is safranin. So what they try to do in the exam is they try to jumble it up. Okay. So they put up methyl violet, acetone, grams iodine, safranin, like this. This sequence change they will do in the exam. So that sequence change, how you remember of? You remember in this sequence one, this mnemonic methyl gas.